If you do equine medicine, you're going to deal with this, Equine Protozoal Myelitis, or EPM. It's due to Sarcoidosis neurona. The possum is the definitive host. The horse just happens to be in the way. It's an accidental host and a dead-end host. But they develop a myelitis or encephalomyelitis, and CNS signs incur. And because horses that have CNS signs often become downer horses, there's a high fatality rate with this. Simply, sometimes they have to be euthanized for humane reasons. The prognosis really depends on the severity of the disease when treatment begins. A lot of times they will not return to normal CNS function. They will have some sort of residual deficit. Okay. Equine medicine, if they haven't already, they'll talk to you about staging this disease as far as clinical signs. And typically you see an improvement of one stage from wherever they were. You can get them to the one stage above that in improvement, but usually not more. So residual signs tend to be a problem. Okay, treatments are all oral. There are 3 approved treatments for EPM. The first treatment to be used, and at the time it was extra label use of the human products, was pyrimethamine sulfadiazine. All right. So the pyrimethamine especially is appropriate as an antiprotozoal. Eventually, a commercial product was approved. That's Rebalance. It comes as a solution you can use. Now that we have the others to compare it against, it's kind of commonly accepted that there are some drawbacks and there's some benefits. The major drawbacks: it seems to have a slower onset and require a longer duration of treatment, often treating 90 to 270 days, according to one source. The benefit is it's the least expensive of the EPM approved drugs. So an efficacy around 50% or so. Okay. All of these are not great. For all 3 of them, we're typically, there's some numbers, talking around 60%, give or take a little bit. Okay. Now, food and supplemental folic acid decreases the bioavailability. So you want to get hay, grain, food away from them at least 2 hours before you give them the Rebalance. So feed restriction, not true fasting in the sense of 24 hours, but at least several hours before the solution is given, no food. The folic acid, of course, comes in because of how pyrimethamine works. People thought folic acid would prevent the side effects. You recall from the discussion on the potentiated sulfamides, it does not. It takes folinic acid to prevent those side effects. And folic acid may actually be detrimental when supplemented because it interferes with the absorption of the drug. So folinic acid, yes. Folic acid, no. And as mentioned, it is a teratogen. You get some mild bone marrow suppression in the horse, possibly neutropenia and thrombocytopenia, but anemia into the mid-20s or so is not uncommon. Usually it will resolve when you discontinue the drug, and typically doesn't require stopping treatment, luckily. Now, I would venture to say that the gold standard now, the most commonly used EPM drug, is Panazaril, which is Marquis. It's an oral paste, extremely well tolerated, few side effects. Its mechanism of action you don't have to know because it's kind of unknown, really. They've got some ideas. A couple of things to know about it, though. It's got a long half-life, so it takes about a week to reach steady state if you give a maintenance dose. So most practitioners are going to give a loading dose of this. The other thing is oil or fat in the diet increases absorption. So it's really common to give some corn oil with it just before you give it. It increases bioavailability about 25%. So marquee, remember, a loading dose and corn oil or fat in the diet. Rebalance, remember, fasting and avoid folic acid. Now, marquee is approved for 28-day treatment, but most people go longer than that. Some will increase the dose 50% to 2 times as much and extend the duration. Extending the duration is the most common thing. Oftentimes they'll keep them on, instead of just 1 month, they'll keep them on 2 to 3 months. It's really, they go to where they plateau out in their clinical signs, and then they go a month or 2 after they plateau. Related to marquee is protozoal or DACVCP, same family, about the same efficacy. Again, all of these are around 50 to 60% effective. This is just another dosing option. This comes as a top-dress pelleted food that you can use instead of the paste, but otherwise pretty identical. Now, this fourth one is not approved. Just want you to know it's out there. Here's decox again. I said you see this in other protozoal diseases. So this is decox. And levamisole is a dewormer, but it's in here as an immunostimulant. So it's been called Orquin. I've had this little thing here about it undergoing clinical trials for like the last 10 years. I've kind of given up that it's ever going to be approved, and I can't find anything about it. Some practitioners like it and will have it compounded, but largely the diclazaril or pinazaril are the most commonly used of the EPM drugs. Okay. Giardia. All right, there's your little organism right there, with 2 eyes staring at you. All species are affected. It's a zoonotic causing pretty severe diarrhea. Evidently, this is really common in the mountains. Hikers will go into the mountains and they'll drink the crystal clear spring water in the mountains, not realizing that around the bend a bear just took a dump in the stream. And then they come down with Giardia, which is pretty miserable. I know I did have a zoonotic instance. A client brought in her, I think it was a little dachshund. Student took it in, we diagnosed Giardia, went up there to explain what needed to be done, and there were like 3 kids from like 2 to 6 running around all over between her legs and everything. And I said, oh no. So I told her, what your dog has, you and your kids can get. It's very contagious, so make them wash their hands, try to keep them away from petting the dog until we get through all this. If they get diarrhea, tell the doctor what I've told you. And sure enough, she came back for the recheck, the dog was fine, they all got Giardia, and all had to go through the treatment. All right, so what are the treatments? Well, probably they went through metronidazole. Metronidazole was our drug of choice for decades against Giardia, and it's still what they use in human medicine. But largely fenbendazole has replaced it in veterinary medicine. Okay. It was actually kind of a serendipitous finding. First, albendazole, a related benzimidine dewormer, was discovered to be effective. But albendazole in dogs is a teratogen and can cause bone marrow suppression. So then they tried fenbendazole, which is extremely safe and well tolerated, and it worked as well. So now I would say fenbendazole, which is Panacure, at the deworming doses is pretty dadgum effective against Giardia and well tolerated. So for the most part, it's replaced metronidazole. Here again, the nitrofurans are alternatives. You might be seeing a pattern here. They're almost never the drug of choice, but they're always a backup for a lot of things. So that can be used. Now, just this year, I noticed this drug is now approved in humans to treat Giardia, nitazoxanide, Alenia. And I found a study where it was dosed into dogs that were infected with Giardia, and it was well tolerated and as effective as fenbendazole. Now, the reason I mention it is this, Cryptosporidia. I'll come to crypto in just a little bit, but this is the only drug approved in humans to treat Cryptosporidia. And so that's probably where we will use it more, is if we're concerned about crypto. And a lot of animals do have both crypto and Giardia, or at least it's not uncommon. That's Giardia. Mainly fenbendazole, but keep an eye out for the Alenia. Trichomonads. This, I know you can't read it and you don't have to. This is just making the point that pretty well every species has some sort of trichomonad for the most part. And mostly gastrointestinal. The cattle have, of course, a venereal trichomonad. In dogs, metronidazole is their drug of choice. So trichomonal diarrhea in dogs, and most species, it's the drug of choice. But you need to know this drug, ranitazole, in cats. The trichomonal infection that cats get, the diarrhea that they get, is not responsive to metronidazole. About the only thing it is responsive to is ranitazole. It's an unapproved drug, so you're going to have to get it compounded. They don't like it, it tastes bad, and there is some risk of CNS side effects. So you have to compound it, you have to dose them properly, watch for side effects. They don't like the taste. So it's a bad drug for cats, but it's the only thing that works. Okay, so you're kind of a rock in a hard place. So I mainly want you to know these two drugs. Now this is kind of interesting to me. Carnitazole is approved to treat pigeons. I have no idea how they got a drug approved to treat pigeons. Now, if you race pigeons, you're probably glad they have this approval. But I'd love to hear the sponsor explain why they went to the trouble to do this. But anyway, it's approved. I presume it would work in other poultry. Reform, chloroquinol, is an old drug, acted against a variety of things, but does seem somewhat effective against trick infections, and its main use is in the horse. So Reform in the horse. Now it has these toxicities, the myelopathy, this sort of thing reported in humans and dogs, but it's pretty well tolerated in horses from what I can tell. Reform, pretty well, it's kind of one of those niche uses where if you've got a horse with diarrhea and you can't find anything else to treat it with, it's not responding, some practitioners will put it on Reform boluses, and sometimes it helps. So kind of a non-specific diarrhea, but probably if it works, implies the horse may have a trichomonal infection. And this is one of the things, when you do a fecal, you can find the trichomonals in most feces. The question is, are they pathogenic or not? And that's kind of a debate for the parasitologist. Babesia. Canine babesiosis is a blood parasite, causes hemolytic anemia and associated icterus, can also cause a thrombocytopenia. Outside the U.S., cats get it, but so far as we don't think cat form is in the U.S. Okay, there are two forms, Babesia canis and Babesia gibsoni. They're similar in what they do, but the gibsoni tends to be more severe in terms of its clinical signs than Babesia canis. Also, gibsoni is much harder to treat. I think I need to update. I think gibsoni has occurred outside of California now. So what do we treat Babesia with? Babesia, the approved drug is imidacarb. It's an injection given IM or sub-Q every 2 weeks for 2 treatments for Babesia canis and 4 treatments for Gibsoni. Its structure is that of a carbamate, which means it inhibits acetylcholinesterase to some degree. So to avoid those side effects, we'll pre-treat with atropine or mescopolamine before we give the injection of the imidacarb. Now, it's very effective against the canis, but it's much less effective against the Gibsoni. You can decrease the parasitemia, but it's really hard to clear the parasite, and oftentimes they relapse. Imidacarb is also effective against the rickettsia. Now, we don't use it because we have the tetracyclines. 99% of the time, we can treat with a tetracycline, or we have chlorphenicol as a fallback, enrofloxacin for Rocky Mountain spotted fever. But in Europe, it actually has a label approval for some rickettsial diseases, including anaplasmosis in cattle. But because the Gibsoni is so hard to treat, it's only modestly responsive to the imidacarbs. We have started looking for other things. In man, clindamycin has been used for a form they get, and in one study, metronidazole was somewhat effective against Gibsoni. But probably the treatment most commonly used now is atovaquone. Atovaquone, I mentioned previously, it's a human anti-malarial drug, but when you combine atovaquone and azithromycin, it's probably what we use most commonly now for Babesia gibsoni. Okay. And there's the information about food increasing it, especially fat. All right.